My name is Rashida Blake. Today, I will be presenting to you a presentation on a research I have previously done on emotional disturbances. I will be introducing to you what this disability is all about, the signs and symptoms, the causes, the diagnosis, how to treat it, preventative measures, and so forth. So do enjoy. Firstly, questions may arise about what emotional disturbance means or what it stands for. And a simple way to understand this is to remember that in special education, this disability is associated with severe behavioral issues or mental health. When someone is considered emotionally disturbed, it means they cannot control their emotions or they are not able to access or even express how they are feeling at all. Essentially, it is any state that does not represent regular functioning. Emotional disturbance, it tends to be associated with children who may be experiencing mental health disorders and who may need special education services. Even if that child earns good grades in school, it doesn't necessarily mean that they do not struggle with this disability. It is especially true if he or she does not know how to behave with others. It can be helpful for parents to think about what skills their child should be learning in school that teaches them how to be successful once they are out of school. Education includes skills that relate to daily life, include social and emotional development, job training, as well as post-secondary skills. More information on this disability. The term emotional or behavioral disorder means a disability characterized by behavioral or emotional responses in school which is different from appropriate age, culture, or ethnic norms that they adversely affect emotional performance. Emotional performances may include academic success, social, vocational, and personal skills. This disability, it is more than a temporarily expected response to stressful events in the environment, right? It is consistently exhibiting in two different settings, at least one of which is school related. This disability is unresponsive to direct intervention in general education, or the child's condition is such that general education interventions would be insufficient. I have read an article that Cullion wrote in 2004 that says, though both acknowledge that maladaptive and distressing behaviors, emotions, and thoughts are main components of emotional disturbance. Cullion also states that situational aspects and contexts are emphasized more in the dimensional perspective than any other disease perspective. Emotional disturbance also includes schizophrenia. Characteristics of emotional disturbance. It's an inability to learn that cannot be explained by intellectual, sensory, or health factors. An inability to build or maintain satisfactory interpersonal relationship with peers and teachers is a characteristic of emotional disturbance. So if for some reason students or your child fails to get along with people around them, it may be a characteristic or a trait that you can say he or she may be suffering from emotional disturbance. Also, inappropriate types of behaviors or feelings under normal circumstances is also a characteristic. Another characteristic is a general pervasive mood of unhappiness or depression. So if you realize that they're hardly happy or they're somewhat in a depressive state, that can also bring about the fact that they are probably suffering from emotional disturbance. Another characteristic is that a tendency to develop physical symptoms or fears associated with personal or school problems. The occurrence of this disability. This disability can occur in more than one environment, whether it may be school, home or community, or even genetic and biological factors. So within the school, it is considered that three main general environments can contribute to these conditions, including biology, home, and community. Biological and genetic factors are identified as the causes for emotional and behavior disorders. Some studies have shown that prenatal drug exposure contributes to childhood emotional and behavior disorders. So if it is a case where the parent suffers from an addiction of alcohol drinking or smoking, that can lead to the child being born and have abnormal functions. Home and community, all the factors of the environments has a positive or negative influence on everyone's growth and development. As it relates to school, factors of school climate that may have a positive or negative influence on the students' emotions and behaviors may include positiveness, consistency of rules, expectations. There's some people who, if you have high expectations of them, they tend to withdraw. Or when they do feel as if they have let someone down, they react in an emotional state. Also, high level of supervision in all school settings, high levels of parent and community involvement, cultural sensitivity, and feelings of identification. Preventative measures of this disability is correcting the factors that are seen within the household as well as in schools that may contribute to the problem may be the best way to prevent emotional disturbance in children or teens. Also, creating a level of consistency in a child or teen's life and maintaining a positive environment is one measure to take. Another measure is by punishing unwanted behaviors while on the other hand rewarding desirable ones. So in doing this, they will know the right thing to do, when to do it, how to do it, and where. Another preventative measure is to set plans in place on how to go about resolving conflicts that may arise. Signs and symptoms. It's natural for children to act out due to frustration, stress, or anxiety. However, if these actions are prolonged for a longer than usual period without signs of improvement in their behavior, with adjustment techniques or specialized intervention, that child may be experiencing some form of emotional disturbance, such as anxiety disorders or eating disorders. Other disorders may be OCD, which is obstructive compulsive disorder. They may be having a psychotic break. So these signs and symptoms may include aggression, which can come in the form of pushing, throwing objects, hitting or trying to injure pets or other people. Hyperactivity, withdrawal, impulsivity, immaturity, and difficulty learning. Diagnosis for an emotional disorder or ED diagnosis to be made, there must be an inability to either create or sustain relationships beyond the norm for individual in that age group. Strange behaviors such as laughing at inappropriate times, a sign of inability to learn. Usually there is a general discontent in the child, which may be early childhood depression and physical symptoms of emotional pain. Ways to treat this disorder in individuals should be combined of different methods such as medications, psychotherapy, social skills training. Medical intervention should be approached with caution as it may have surprising side effects such as insomnia, appetite reduction, and depression. Social skill training is also useful as it allows patients to develop self-assertiveness, approachability, and communicativeness. Prescription. As it relates to adaptation and exercise prescription, individuals who suffer from emotional disturbances tend to travel with low self-esteem, may engage in self-injurious behaviors, and has a high stress point. Prescriptions that people would normally, doctors would normally describe different types of things to help children with behavioral and emotional disorders. Some examples are cognitive therapy, behavioral therapy, occupational and physical therapy, parental or family therapy, group therapy. Other different types of medication may be antipsychotics, antidepressants, mood stabilizers, anti-anxiety medications, or those to treat insomnia. But as it relates to exercise prescription and for children to adapt, there are things that can be used, technologies that can be used to reinforce positivity. Also, you have different technology. You have low tech assistive technology, you have mid tech assistive technology, and you have high tech assistive technology. All these, including group participation, which would give the students an opportunity to work with others, for them to have a sense of belonging, are things that can be done to treat this disorder, for them to adapt and to exercise on a mental level. As it relates to supports, it can be overwhelming to find the right organizations and resources that provide the necessary support to the families, children, and those who suffer from emotional disorders. There are some organizations that may primarily focus on assistance, promotion, support services, and research specific disabilities, while others may be general. So, while some organizations focus on general concerns, there are others that may primarily focus on giving assistance, promotion, support services, and research specific disabilities. Organizations that provide the necessary support and resources for individuals with emotional disturbance, such as a APE Center, which focuses on a children's mental health, emotional or behavioral disorder by navigating multiple systems necessary for them to access support services. A school psychologist is a professional who studies and is trained in psychology and education to pinpoint learning and behavioral problems, to assess students for special education services, and to help them with emotional and behavioral health conditions. Other professionals that may be helpful in this area are social workers and guidance counselors. In conclusion, altogether, it is of utmost importance that parents and other persons who may work with or care for IWDs educated themselves in not just emotional disturbance but in all aspects of special education. Emotional disturbance can be caused by factors such as biological, home and community, as well as school, and is a condition that can be prevented simply by correcting problems that are evident within the home or even at school. Hyperactivity, withdrawal, aggression, and being impulsive are all examples of signs that are seen in an individual with emotional disturbance. A quiet zone, otherwise known as a cool-off area, is one type of modification that can be considered for an individual with emotional disturbance to calm their minds and to bring them peace in heated situations.